Today, we're going to discuss what is myofunctional therapy. It's a mouthful, and most people don't know what it is. Did you know that your tongue's resting position can impact everything from chewing, swallowing, to the way you look and speak? Oral facial myofunctional disorders, known as OMDs, refer to issues that interfere with normal growth and development of the oral facial structures, such as the mouth, teeth, tongue, jaw, and face. They may be associated with a range of breathing, swallowing, speech, and overall health issues. Fortunately, you can correct an abnormal tongue position with myofunctional therapy. Myofunctional therapy goes by a lot of names: oral facial myology, oral facial myofunctional therapy, tongue thrust therapy, tongue tie therapy, and myofunctional therapy. Probably more that I don't even know about as well, but they're all the same.
So I like to call it myofunctional therapy, but it's really oral facial myofunctional therapy. So let's break it down. Oral means mouth, facial meaning the face, myo meaning muscle, and functional relating to how it works and functions. So how your tongue functions, how the muscles of your face function. So that's why oral facial myofunctional therapy.
If you can envision physical therapy and how they help rehabilitate and train muscles of your body, then you can apply that idea to myofunctional therapy. It's very similar to physical therapy, but for the face, mouth, and tongue, everything above the neck and below the eyes. I teach people exercises to help improve their function and their muscles in their mouth. Basically, these exercises revolve around the tongue, the neck, the chin. The majority of the people that I evaluate are tongue-tied or have a tongue thrust swallow. But I always tell my patients during these evaluations, these are just clues, and there's usually a bigger underlying issue with the airway. And that's what we really focus on, is how you breathe, your airway. Your ability to be able to breathe like you're supposed to is the number one thing you need to do to survive. We can survive without food for 3 weeks, without sleep or water for 3 days, but we can't survive without oxygen for more than 6 minutes. When we breathe through our mouth, just because we can doesn't mean we should. Myofunctional therapy is all about changing habits and strengthening muscles to improve the way we breathe, speak, chew, and swallow. And it's possible, honestly, to have life-changing results from a myofunctional therapy program. This specialized program can improve oral health, enhance your smile, increase muscle function in your face and your tongue. The causes of myofunctional disorders are complex, and they combine a mix of habits, skeletal structures, and environment. Myofunctional therapy, again, is like physical therapy for the mouth, face, and tongue. Myofunctional therapy is based on a series of exercises that help patients learn to change bad habits that improve tongue placement, breathing, speaking, chewing, and swallowing. All this can have a huge impact on your overall health. When you're mouth breathing, you're going to inhale air. That could cause gastric problems and a whole lot of other things. Every day, we rely on our muscles to work together seamlessly as we speak, eat, drink, and swallow. For example, swallowing requires coordination of the face, mouth, tongue, and throat muscles. We swallow 800 to 2,000 times a day, usually without even thinking about it. What happens if the muscles involved don't work together like they should? Myofunctional therapists aim to correct the habits that hinder healthy development and function. Each treatment plan is customized to a specific individual to create transformation through sustainable habits. Why do oral myofunctional disorders require treatment? Seeking treatment early reduces a range of long-term problems. In the case of growing children, it can be important to seek treatment as early as the age of 2 because it can prevent a lifetime of potentially preventable healthcare concerns. ADHD, sleep disorders, eating disorders, breathing disorders, they can all be helped with myofunctional therapy. According to the Academy of Oral Facial Myofunctional Therapy, most of these disorders originate from feeding with an infant and habitual mouth breathing, thumb sucking, finger sucking, especially when sleeping. If insufficient nasal breathing is happening, there are a variety of different causes. We talked a little bit about them: thumb sucking, finger sucking, low tongue posture, low tongue tone, forward head posture, thrusting your tongue, being tongue tied, being lip tied, And they could have a functional issue like enlarged tonsils, enlarged adenoids, habits sucking on your hair, chewing on your hair, sucking on your clothes. My daughter did all of that, and I didn't realize it was actually a symptom. Crooked misaligned teeth, abnormal growth development, abnormal breathing, gum disease, gingivitis, cavities, snoring, clenching, grinding, dry mouth, trouble breathing, trouble sleeping, gut issues. And so our goal is to correct these habits. Correct tongue posture, forward head posture, open lips, breathing through your mouth, open bite. Through myofunctional therapy, patients can increase their ability to breathe, sleep, eat, and swallow. Even though we're not speech therapists, just getting your tongue in the correct position can help with speech, especially if you have a tongue thrust. Some speech pathologists are also myofunctional therapists and some are not. So not all practitioners know the same things. Some dental hygienists are myofunctional therapists. Effective treatment can improve appearance depending on the nature of the disorder. Therapy adds a whole bunch of benefits that can improve self-esteem and confidence as well. Myofunctional therapy has 4 goals. Breathe through your nose, lips together, tongue on the roof of your mouth, and correct swallow. The first thing we need to survive is to breathe. Breathe through our nose. Our number one job is to help people breathe through their nose. You need oxygen to survive. We talked about it. This is no joke. It's real. Here's the deal. If you can't breathe through your nose, you're going to breathe through your mouth. And guess what? If you can't breathe, you die, right? Just in case you're wondering, we have to be able to breathe. We're lucky that we can breathe through our mouth, but we're not functioning correctly or optimally. We treat our head separately from our body. We even have a different insurance for our mouth and our body, but it's all connected. In my opinion, when we're talking about health, we should start talking about how are you breathing? How do people breathe? If you're able to breathe, or you're someone that's just been breathing to survive, you don't want to just survive. We want you to breathe. We want you to thrive. We want you to see an ENT. Why can't you breathe? When you breathe through your nose, your body absorbs 18 to 20% more oxygen to your brain. When you're a mouth breather, you're not healthy. Our job is to actually help you transform your health, your symptoms into lifelong sustainable habits that make changes that will work for you. So you don't just stick through the treatment, but they stick with you when treatment is done. Lifelong sustainable habits. Myofunctional therapy. Breathe through your nose, lips together, tongue in the roof of your mouth, correct swallow. We want you to feel inspired, supported. So myofunctional therapists really want the best for you. We will help give you the exercises that you need to help those muscles function correctly. And we'll look at a range of things that are going on. We ask a range of extensive medical history, past, present, future. We want to know what's going on. Keep in mind, nothing here that I share is individual medical care. Therapy are custom to each patient's needs and health history. So always discuss your concerns and symptoms with your doctor, with your dentist, with your myofunctional therapist. Collaboration is key to receiving the appropriate care. Myofunctional therapy may be an interdisciplinary approach. You might need a chiropractor, an orthodontist, a physician, an OT, a PT, an osteopath, a body worker. There are all kinds of people that can help you to function the way that you're supposed to. Myofunctional therapy exercises are a piece of the puzzle that help you be healthy. Children love it because they can stick out their tongue. Most parents are telling them, keep your tongue in, but with myofunctional therapy, you have to stick your tongue out, so it can be fun. One of the exercises we do are tongue clicking, where you put your tongue on the roof of your mouth, so your tongue gets used to being up on the roof of your mouth. And when you say N, your tongue is usually up where it should be. N. You can stick your tongue out and try to touch your nose, or you can stick your tongue out and try to touch your chin. This is a way to stretch that frenum attachment under. Or put your tongue side to side, like hold for 5 seconds and then stick it out to the other side. Hold for 5 seconds. We want to see what's happening with your face and neck. Is your jaw moving? Is your tongue dragging? What's going on? Those are some of the things that we evaluate. These are just a few exercises that are effective. Depends on what's going on in your mouth, what we recommend. We want to get your lips together, breathing through your nose, tongue on the roof of your mouth, and swallowing correctly. So there are a sequence of exercises that are different for a child that is breathing through their nose or an adult that needs a CPAP machine. So exercises might be different for a child that's a mouth breather or an adult that doesn't have enough room for their tongue. So the next steps are, if you suspect you or your child are having problems with mouth breathing, with tongue thrusting, with tongue tie, with nasal breathing, you can click below and schedule a call with me. I offer a 10-minute free call to talk about these things and see where we need to send you. I might not be the person that needs to help you. If you can't breathe through your nose, myofunctional therapy isn't going to be helpful. We have to start here first. So we start from the top down. With children, it can lead to developmental problems, sleep disorders, ADHD, mood issues, behavioral problems, anxiety, depression, speech issues. Adults' habitual mouth breathing can contribute to other things, gut issues, irritable bowel, getting up and going to the bathroom in the middle of the night, not sleeping, not being able to focus. For more extreme cases, they might have sleep apnea where they stop breathing. And this is causing a lot of issues to our body because then our sleep isn't happening. And when we're not sleeping, that's when we rest and repair. So when we're not sleeping, we're not resting and repair our body. If I can help you, click the link below. Hope that this is helpful because depending on your exact issue, you may need a different specialist than just a myofunctional therapist. So click the link below if you'd like to learn more from me. If you resonated with this, please comment, share, subscribe. Find me on social media. There are links below. Just get in contact with somebody who can help you breathe better. Share with someone else. Myofunctional therapy can help people breathe better all over the world. We really need to get this information out there because a healthy mouth is truly a healthy body and a happy, healthy life. As always, thanks for listening. Have a great day. Until next time.